Guys, the city health department says that testing sites throughout the city have not been collecting age, race, or zip code information from people as they are tested. That makes it very difficult to see whether or not an individual neighborhood or group is oversampled or undersampled. In Philadelphia, nearly 70,000 COVID-19 tests reveal nearly 20,000 positive cases.
We are seeing a greater number of cases on a per capita basis among African Americans than among whites. Actually, a greater number just in terms of raw case counts in African Americans than among whites.
According to the most recent census, 42% of Philadelphia is African American, but African Americans account for 52% of all COVID-19 deaths in the city.
Everything we do needs to focus more attention on that population. The mayor totally gets that, and a lot of his administration is built around trying to get more equity in our city.
But the city health department says it has no way to know if testing has been equitable. The city hasn't tracked how many African Americans or groups of any kind have taken a test. We only know which groups tested positive.
How are we supposed to move the needle and improve the health outcomes for Philadelphians without knowing where the resources need to go?
Dr. Ayla Stanford is leading a group of doctors, nurses, and volunteers called the Black Doctors COVID-19 Consortium. The group rolled out its own testing in a dozen different locations. Dr. Stanford says they've tested 3,600 people because the group broke down barriers to get tested.
You often need an appointment, you need a referral, and in some places you have to be in a car to get tested. Suggests to me that a majority are not African American, because those are the barriers that many African Americans were facing.
Medical experts from Dr. Farley to the Centers for Disease Control and Prevention link income and race to medical problems from heart and lung disease to diabetes. They say COVID-19 is following that pattern.
In general, health problems track social problems. So any group that is socially disadvantaged because of racism, because of the fact that when you're poor, you don't have access to things that people wealthy have, those people are going to end up having more health problems. And so we like to talk about that in general public health. COVID has just brought that to light.
What's your ability to change the health outcomes as the health commissioner in these neighborhoods that need help with COVID?
We can absolutely target our messaging about social distancing, and we can target our testing to the populations at a greater risk. When you get to these much more deeply rooted underlying social problems of income inequality and racism, all we can do is talk about that and say that that does drive health outcomes and has an impact on people's living or dying. We can't necessarily fix all that, but talking about that is a contribution to solving that problem.
And the Philadelphia Health Commissioner does say that the department would like to have demographic information about everyone being tested, but the Department of Health notes that the state is in charge of regulation and manages any associated risks legally and from a privacy perspective. That's the latest from Philadelphia. I'm Mitch Blacher, NBC10 News.